Greetings to all my fellow surgeons and colleagues. Hi, I'm Dr. Simanchal Goel, and today I'm going to present you a very important case that shows the importance of the right technique, the right way to chop a nucleus. If you go to the internet and search nucleofractis techniques, the techniques to crack a nucleus, there are around 10 to 15 different kinds of techniques mentioned on the internet for cracking a nucleus. In my experience, all the new surgeons, the resident surgeons under training, the senior residents should know the golden technique out of all of them. One technique that I have always followed, one technique that is the most important technique, the most efficient one with the least phaco energy involved, is undoubtedly the vertical chop technique. Vertical chop is special in a lot of ways, and I am going to demonstrate you the importance of vertical chop. Out of all the techniques that I have tried, divide and conquer, horizontal chop, flip and chop, the vertical chop seems to be the most efficient technique. Going on with the usual steps, I have created the side ports, the main port, the rexes, and as you can see, the nucleus grade is around 4 and 5. The nucleus grade is between 4 and 5, and it's a hard nucleus. I'm going to do hydrodissection on the right side and on the left side. I generally don't dial the nucleus as I know it will spin. By now, I'm injecting visco elastic in the anterior chamber, and as you must have read the thumbnail, I don't need a chopper. I don't need even a chopper if your technique is right. I'll hold the nucleus with the belly from the phaco, and here you go. I am placing a dialer just to show you the importance of the technique. It's all about technique, it's not about the instruments you take. You can even chop this kind of hard nuclei only with a blunt dialer if your technique is right. Clearing the superficial cortex, burying my phaco tip deep down, as Dr. Pradeep Mohanta says, it's a kind of submarine chop. Phaco pedal 3, 2, and chop. Just see the tip of my dialer. It is as blunt as it can get, but it is still chopping with effortless moves. By now I have made 2 pieces, and I'll go once again, clearing the cortex. Phaco position 3, phaco position 2, holding and separate. Mind you, it is not a sharp chopper. The nucleus is grade 4 and still it is chopping. And here you go, once again, chop. 4 pieces right away. You can see the color of the nucleus. It's somewhat yellowish brown. The endonucleus is brown in color. And that's all. The case is finished. For me, chop is the most important step you need to learn. In your training days, concentrate on chop and only chop. Once you are a brilliant surgeon who has mastered the chop, the things will be very, very easy for you in the long run. Out of 8 or 9 steps the phaco has, I have mastered chop. And once you have sufficient experience, you can just go on and play with your instruments. I don't need a lot of instruments to complete my phaco, and that is the sign of a versatile surgeon. Chopping with the dialer is a very good method to ensure the safety of a patient. You can employ this dialer used as a chopper in those VIP patients in which you want to increase that margin of safety, decreasing the chances of PCR from a sharp chopper. This is a notorious small piece of nucleus that was incarcerated in my main port. I just dislodged it with my dialer and the case is almost complete. And that's it. Once again, I would like to emphasize you the importance of the technique rather than the instruments. Concentrate on the technique. It should be quality surgery and not quantity. Don't concentrate on the quantity of the cases you are getting. Concentrate on the best you can do, even if you get one case in your training days. You hold the nucleus firmly with your phaco, pull the nucleus up and push the nucleus down with your dialer or a chopper. These two opposing vertical forces will cause a good nucleus crack. Crack until you feel you are brilliant enough to go about these hard cases. You might be thinking, why did I not implant the IUL right now? As I was implanting it, I just noted that the trailing haptic was broken in this case. My OT assistant must have put it the wrong way and it had a broken haptic. I have called my OT assistant for a reserve IUL. This patient is a VVIP patient and we had kept a reserve IUL for the patient. My staff is opening the reserve IUL right now and I am talking to the patient. One technique that you can employ to make the patient even more comfortable with you is to talk about their name. You can ask them about their family, how many children do they have, what do they do professionally. And these reassuring feedbacks that you give the patient increase the patient's compliance and the rapport with you, if I may add. Once you say that your surgery is going really well, you are looking in the light really well, the patient will thank you. It increases your rapport and your loyalty and your patient base. So I think these audio feedbacks from the surgeon to a patient are also very important, because the patient knows the average surgical time, that is 5 to 6 minutes. If you happen to increase your surgical time, you should tell the patient why is it taking so long. You can tell them that you are busy polishing the inside of the eye for great visual results, and the patient won't mind. At the end of the day, they want the best results out of the surgery. Putting a monofocal Johnson & Johnson IUL in the bag, implanting the trailing haptic. It's a beautiful case. The rhexis overlaps the optic 360 degrees. And this patient is going to be really happy with the vision. As far as I can remember, the patient was counting finger 3 meters and he achieved a vision of 20 by 20 or 6 by 6. Just another fun case to show you the importance of technique over the instruments. Once you have a volume of 1000 or 1500 cases under your belt, you can achieve anything surgically and professionally. I hope you like my videos. I would request you to subscribe and like these videos. which motivates me to put some special cases on my channel through which you can learn. Kindly share my videos. That's all from my side, hydrating the main port. And thank you.